Bismillahirrahmanirrahim. Today we will discuss about back slab and complete method of back slab. Uh, First of all, see complete detail or history of fashion and documented form, and then second step you see the X-ray and target the location of fracture or dislocation. Sometimes a wound may be occur superficially, and this situation apply gauze piece with 5D and wound area. The next step covering the area through ortho-1 cotton. Uh, First of all, apply the cotton around 15 centimeter target location. When you cover the area throughout the one cotton, you must be measure the area and then take the gypsona. Measure gypsona about 6 to 8 foot and depth and water for 5 seconds, and then remove the water and suddenly apply target area. You know, one gypsona is not enough for big slab. You should be take 2 to 3 gypsona at a time for one big slab. When you apply gypsona on target area, be careful and this on this time, because you know gypsona is consist of gypsum, about 70% of gypsum, and gypsum is irritant for skin and damage the skin. And then take water and tub, dip the gypsona in water for 5 seconds, and then remove the excessive water from the gypsona. After that, take the crepe bandage, mostly 2 crepe bandage as enough for back slab, and apply the crepe bandage above the gypsona. After that, an overlaying you must be apply sling or full sling.